Well, a recent U.S. Senate Health Committee hearing revealed 16 million Americans are living with long COVID, and 4 million Americans are out of work because of the condition. Dr. Philip Levy, a professor of emergency medicine and associate vice president of transitional science at Wayne State University, is joining us now to talk about the latest on the COVID-19 front and the potential impact of long COVID patients. So, Dr. Levy, thanks for being here. What exactly is long COVID, and why do people need to know about this condition?
Good afternoon, Emily, and thanks for having me on. So it's critical that people know about long COVID because these are symptoms that develop after folks recover from the initial infection. So the cold, cough, runny nose, sore throat, fever, body ache stuff that people experience and tends to go away in 3 to 5 days. That's all fine and well, and generally most people recover from that. But as you mentioned, a sizable number of people will develop a constellation of symptoms. There's 200 plus symptoms that have been reported now for long COVID, and these develop weeks to months after someone seemingly thinks they're getting better. And it can be very troublesome for people. So things like brain fog, confusion, or disorientation that persists after the acute infection, may make it difficult for people to concentrate. It may make it difficult for people to work. As you noted, millions of Americans are out of work. And then you have folks who develop things like persistent shortness of breath or cough. That can be troublesome and make it hard to do activities of daily living, things like walking your dog or just going to the corner store to get some food. People are also reporting mood disturbances, things like anxiety or depressed mood, or even frank depression related to this, and insomnia. So all of these things, that didn't exist before COVID, that people have afterwards, can be quite bothersome.
Yes, I've heard a lot of clinicians, and I feel myself like I've experienced the brain fog part of it. How do these symptoms, how does long COVID affect a patient's quality of life?
Yeah, so like I was saying, if it interferes with your activity of daily living, it's tough. You can't do the things that you were doing before. You might not have a clear explanation as to why. People might even blow you off and say, hey, you're faking that, or you just don't want to go back to work, or whatever it is. And that's not the case. These are very real things that people are experiencing. And so the symptoms themselves, the concern around the symptoms, and then even that sort of peripheral thing of do I even have these? Do people believe me? All of that can be very impactful.
And who is at the highest risk for developing long COVID?
So people with the most severe infections are at the highest risk, but anybody who's had COVID, even if they didn't get tested and didn't know it, they can still be at risk for long COVID. But people with severe infections, those who got admitted to the hospital, potentially in the intensive care unit, are at high risk, as are those who have comorbidities such as high blood pressure and diabetes and heart disease, people with advanced age. Not only do those risk factors make severe COVID more likely, they make getting long COVID more likely. But the category that probably is difficult to talk about, but most important, is the unvaccinated. We know that people who have gotten no COVID vaccines are more than twice as likely to develop long COVID symptoms. And we know that getting vaccinated really does help prevent those symptoms. So that's a group that we can all do something about. We can't change ages and we can't change comorbidities, but we can do something about our vaccination status.
And so is what you're saying is that's how we can prevent long COVID. So what can people do to prevent long COVID?
So foremost, you can try not to get COVID. And we know that the principles from the very early days of the pandemic still hold true. If you have COVID, isolate. Don't put yourself around people that you might get sick. If you're around people who have COVID, mask up. That still does confer benefit and protection for the individual themselves. But like I was saying, vaccination is critically important because we know that even if you were prior vaccinated, that immunity that results wanes over time, meaning that the response just isn't as robust as it was in the very beginning. Plus, you have these variations of COVID that continue to evolve. All of the cases now are predominantly being caused by the JN1 variant, which infects the body and hits the body different than the prior versions. So the updated vaccines, the ones that reflect the continuing evolution of the virus, are critical to take so that they can help prevent severe cases of COVID and thereby, prevent long-term COVID.
Okay, all important information. Where can we go to learn more?
So you can go to vaccines.gov. It's a terrific website that was developed in the early stages of the pandemic by the federal government and continues today to provide invaluable resources, information on COVID, emerging variants, vaccines, updated vaccines, but most importantly, regional information and local information on where you can go and make an appointment to get a vaccine today.
Okay, perfect. Dr. Levy, thank you so much for being here today.
My pleasure. Thanks for having me.
Still ahead.